Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about methylene blue. Methylene blue has been around for a really long time, and it is a dye, and it does have to be compounded. Insurance does not pay for it, but it is an excellent medication for the treatment of Bartonella. It also crosses the blood-brain barrier and helps to decrease neuroinflammation quite a bit. So it's good for your patients who have brain fog, if they have a family history of Alzheimer's, if they have Lyme. These are the people that, and neurobartonellosis, these are the people that can really be helped by methylene blue. Now, there's a couple of caveats about using methylene blue. The first one is you have to get tested for something called G6PD. G6PD stands for glucose 6-phosphate dehydrogenase, and that is an enzyme, and if it is abnormal, you are not able to take methylene blue. Methylene blue can also cause elevated serotonin levels, which is a neurotransmitter in the brain, and you can get something called serotonin syndrome, which is not good. And oftentimes you need to be hospitalized for that. You don't want to use methylene blue, obviously, in pregnancy. And anybody who is allergic to dyes in any way, I would be careful. I would start very low and go slow. The other thing about methylene blue is that it will turn your toilet bowl completely bright blue. And what you do is you take some Clorox and you put it in the bowl after you pee, and then just take your scrub brush and rub it, and it'll come out. But if you leave it, it will be permanent. It'll be a permanent stain. You will have a blue tongue, and but so far, methylene blue doesn't really cause herxing. It really doesn't cause any side effects that I've seen. And I've been using it now for probably 5 or 6 years. And I have a lot of patients on it because it works so well. And you can layer antibiotics on top of it. So it's a great medication. You do have to get it at a compounding pharmacy. I choose to get mine at InfuServe, and they'll compound it and mail it to you. So that's a great benny of, it's not that expensive. For 100 milligrams twice a day for a month, I think it's around $150. So it's not terrible, but the benefits of it are huge, and it works really well. So I would encourage anybody who has Lyme and Bartonella to try methylene blue. And you should get blood work done once a month to check and make sure that your liver and kidney are okay. They always are, but it's just very good medical practice to be vigilant like that, because you wouldn't believe what I catch. I just had a patient last week who got hepatitis because she had really elevated liver enzymes. So, people balk at doing lab work, but let me tell you, it saves a lot of people's lives. So I apologize for my voice, it's so grovelly. So give methylene blue a try, or ask your provider if they'd be willing to do that, and see how it goes. Alrighty, have a wonderful day. Take care. Bye-bye.